Today I get the privilege to interview Dr. Keith Smith, who is the co-founder of the Surgical Center of Oklahoma. And in my opinion, I believe that the Surgical Center of Oklahoma, or SCO, is the most competitive surgery center in the U.S. So we're going to have a discussion with Keith and learn a little bit more about it. Keith, thank you for the interview.
Thanks for having me on.
Great. If you're an agent and you're looking really for the most powerful way of containing healthcare costs for your clients, you definitely need to watch this series of videos we're doing on SCO. And you'll find out that there's a lot more behind the curtains with our healthcare system that is working in a negative direction versus the free market direction that SCO has. So with that, Dr. Smith, if you could take a minute, tell us a little bit about who you are and what your background is, and then tell us about what you and your co-founder did to, or what need you saw that needed to be filled with building the SCO.
Well, Steve Lonte and I started the Surgery Center of Oklahoma in 1997. We'd both started our private practices in 1990 and had just seen enough in the big hospitals that we felt like we could complain about high prices and declining quality the rest of our careers, or we could do something about it. So we bought an old, corporately mismanaged, burnout surgery center on a hunting trip, actually. And we decided that we would do some things differently. We would settle for nothing but the highest quality of care. We'd only work with surgeons who were ethical and top competency. We would always be honest with our pricing, and we would never accept a dime of money from the government. And we've stayed true to those principles. We were very successful early on. We had a reputation for extremely high quality. We were the designated facility for the Division I athletes in the state of Oklahoma, and so it was just a very high quality, very well-known facility for quality. Right after we opened, we started getting calls from patients that had no insurance that would ask us pricing, and how much would it be for me to have, say, a breast biopsy? And I wasn't schooled in the ways of the typical hospital administrator, just ripping people off and bankrupting them. So I would just put the patient on hold and call the surgeon and ask them, how much do you want to perform this breast biopsy for your professional fee? And as an anesthesiologist, I knew how long it was going to take, and we basically billed for our time. I knew what supplies would be needed at the surgery center and how long we would be in the operating room to do that case. And so you just add all that up and come up with some pricing. And so early on, within the first few weeks of opening in 1997, we were quoting bundled transparent pricing over the phone, not realizing how radical that was. Over time, the requests were varied enough that we created a list and marveled that people's reaction to us actually answering their question, how much, that people were completely puzzled by that, but we didn't know any different. We discovered early on too that there was this puzzling reaction to very high quality and low prices from the carriers. The carriers wanted nothing to do with us. And we didn't know if they were just chummy with the hospitals and the hospitals told them stay away from these guys, or what the deal was. We didn't understand that. But we really didn't care because our prices were so low that out of network patients could pay us our complete fee and still in an out of pocket way be better off. We were very successful working along this model, so much so that we built the facility that we're in now. We have 62 surgeons here now. We started with 10, so we've grown tremendously. In 2003, 2004, the insurance companies, the big carriers, started stacking deductibles on the patients that were coming here. So they financially found it more and more difficult to come through our doors. It had a devastating effect on our patient volume. So we decided to double down. Thought, we're cheaper, we're better. The quality here is unsurpassed in this whole region. And I thought, we need to put these prices out where people can see them. So long story short, we launched a website, put our prices online, and all of this was consistent with our founding mission and principles of being honest about our pricing, not being interested in generating revenue so much as delivering value. And that's really what separates the culture of the Surgery Center of Oklahoma from a lot of the so-called charitable not-for-profit hospitals that charge multiples 8, 10, 12, 15 times what you'll see that we have listed online. The result of us having engaged in this launch of transparent pricing has been nothing short of just phenomenal. Patients come here from all 50 states except Hawaii. The first patients that showed up after we put our prices online were Canadians. So, here are folks that have coverage. They have universal coverage, they just don't have any access. And that's what people in the United States have to look forward to if the government gets even more involved in healthcare. So that's our story in a nutshell. And it's been a really, really interesting, fascinating experience.
Well, it certainly is. Prices continue to go up, and access to good, affordable healthcare is going to continue to go down. I think it's going to bring you in similar facilities more to light as time goes by. So could you give us a little bit more of a background on the SCO? You told us about how many surgeons you have. How many surgeries, and tell us more about the facility itself.
The facility's a little over 30,000 square feet. We have 7 operating rooms. We do between 500 and 750 surgeries a month. And it's seasonal a little bit, although the seasonality is beginning to go away. It just seems like it's busy all the time. We do urology, general surgery, orthopedics, ear, nose, and throat, pediatric ophthalmology, all manner of cases here, spine, total joint replacements. So there's a big variety of surgeries that are done here, and a staff that we've been open 19 years now, and many of my original employees are still with us. So it's really like a family. It's a real culture where all of the people in the building understand who our customer is, and they know that our waiting room is full because we actually provide value, not because we're signed up on some plan. And that everybody here takes really great pride in what they do.
Yeah, very efficient. As a matter of fact, about 3-4 weeks ago when we first talked, I'd mentioned that I might be interested in coming down for a procedure for myself. And I said, well, what's the turnaround if we were to connect? And Keith said, well, I can get you in here tomorrow. Just let's go. So it's like, wow, I can't even do that with my dentist, let alone with my own doctor or hospital. So very, very interesting. So we're talking primarily with the agent community. And there's this perception that, just like anyone else has, if you put a Honda Civic against a Mercedes, which, what are you paying for and what kind of value do you get out of it? For you being such low cost, what type of accreditation does this facility and the doctors have? And help us to get past the idea that with better quality comes higher prices.
Yeah, I used to believe that there was no relationship between price and quality. And now I'm convinced, as is Jeff Rice at Healthcare Blue Book, there actually is a relationship between price and quality, but it's inverse. And it's counterintuitive, but when you think through it, you realize high prices are just an indication that a market is a cartel, that there is not adequate competition involved. Lower prices means somebody is in there mixing it up. Somebody is competing. And when people compete, they don't just compete on price, they compete on quality. And if anything, to have reasonable prices available for all to see invites an even brighter light to shine on us to demonstrate our quality. So we're actually under more pressure to provide a high quality experience here than somebody else that's charging multiples of what we charge. We put all our infection rates online. I challenge any facility that charges multiples of what we do to do the same. So there is a relationship between price and quality, but it's counterintuitive. It's actually inverse. The $30,000 hernia surgery across town from us at the so-called not-for-profit hospital is not 10 times better than the $3,000 hernia surgery here.
Yeah, absolutely. And the key part here is free market, and that's really what it's about. When you take the government or bureaucracies out of any kind of market and let the free market do what it should do, then you're going to always have a downward push on prices.
And an upward push on quality.
And on quality,
Absolutely.
Yep, I agree.
Another important point about pricing too is that when Harvard birthed what I call the Rosemary's Baby of healthcare, the resource-based relative value scale, it was an attempt to convince everyone that central planning was a good idea in healthcare pricing, where some all-knowing person could say, this is what every imaginable healthcare service is worth, and put the price on it. When that happens, they're always wrong. Every assignment of pricing is wrong. It's either too high or too low. If it's too low, then that service is going to be scarce. If it's too high, then more of that is going to be done than ought to be done. So one thing to remember about free market pricing, it is the result of competition in the marketplace. It emerges from competitive activity. If a surgery center opens up across the street from me and posts prices and they are lower than mine, I have to decide, how am I going to respond to that? Am I going to match those prices? Am I going to make the quality experience here even more realizable for the patients? But the real, true, rational pricing emerges from competitive activity. It's never imposed top-down. And I think that's really important for people to understand.
Yeah, absolutely. We hear a lot about healthcare overseas, getting surgeries done overseas. How have you stacked up with countries like Brazil, China, and other countries that offers high-level quality care? And how have you stacked up, and are you seeing where people are making a transition and saying, you know what, maybe we're going to look at SCO before we look at having procedure, what do they call that?
Medical tourism.
Medical tourism, that's it. And I'm an insurance agent, right? So, okay. So yeah, what can you share with us?
Our prices are similar, and in most cases lower than what you'll find overseas. They're certainly lower if a person in the continental United States takes into account their travel costs. I've been told this by people who have shopped around and they were going to go to Cuba or Panama or Costa Rica or India, and they found our facility and our pricing. And the vast majority of time, our pricing is equal to or less than what they found overseas. Certainly is less if you take into account the expense of travel. One thing that's interesting is when the so-called big hospital, not-for-profit big hospital systems say, well, this bundled pricing, it's impossible. I mean, we can't do it. This niche surgery center can do it, but we can't do this. It's crazy for us to even be asked to do this. While the hospitals overseas are actually competing with that bundled pricing. So I just think it's fascinating that the folks in Brazil and Panama and India have figured this out and the hospital systems here in the United States have not. And of course, the answer is obvious. I mean, they benefit from price opacity, and it helps them see what they can get away with rather than actually render value.
Okay. Yeah, and actually, we talked a little bit before this video about what's really going on with pricing in hospital facilities. And we're actually going to hopefully do a podcast in the upcoming weeks to talk a little bit more about what's really going on. Why is it that pricing is so much higher in hospitals than surgical centers such as yourself? And let me draw something out here. You mentioned the healthcare Blue Book, right? So what kind of relationship do you have with that organization?
We don't have any relationship with them. I know Jeff Rice, the founder, and I'm also co-founder of Free Market Medical Association, and frequently the last 3 years they've had someone come speak at our meeting. They have red, yellow, and green areas. Green pricing is kind of reasonable for the region, yellow is caution, and red is stay away. And much of our pricing is actually below their green level of pricing. I know they hold us up to other facilities as an example to emulate, and they have a fascinating organization and business, and they think very highly of us for sure. We don't have any kind of relationship with them at all, though.
Okay. Well, part of why I asked, when people are shopping for surgeries and trying to get true cost, it's a beautiful thing. You go to your website and you can look up the price of every surgery that you perform here. Now the hard part is, where do we go as the consumer to find out what our local prices are? And no one really talks much about that. And so here's a little bit about what's going on with me personally. Why am I sitting down here in Oklahoma City, 98 degrees out, compared to northern Michigan? And I'm sitting here as a consumer that needs a surgery, but at the same time, I'm an agent that's trying to find a way of helping my clients and helping other agents to find a way of providing lowest cost healthcare for our clients. And that's what it's all about. And I'm on a HSA, high deductible HSA plan. And I'm on that high deductible plan because I have to do what every other agent has to do. We're in a broken healthcare system, and each year when we see a 10, 20, 30, 40% rate increase, what are our options? The system is broken, and there's not much you can do other than say, well, client ABC, we can mitigate that increase. We can cut it from 30% to 10% if you just go to a higher deductible plan and a higher out-of-pocket maximum. So what happens is you get that compounding effect until eventually everybody, to mitigate the costs, are on high deductible plans, meaning you're going to pay out of pocket first. So now the discussion anymore, now that we've gone down that road, why have that discussion anymore? The discussion should be price transparency. The discussion should be, how can I take a surgery that I need to have and price it out, shop it out? I mean, we shop out everything else. Big screen TVs, computers, you name it, we shop it out. Why don't we do that with our healthcare? So the steps that are necessary to get us there, I'm not so sure that the Affordable Care Act or a lot of insurance companies really care to give us a roadmap on how to do that. For me, I came here because I not only believe in agents taking a serious look at turning this model around and looking at price transparency versus price of, premium of the insurance policy. So I'm having a hernia surgery here myself. And So when it came down to pricing it out, I'm puzzled. I'm thinking to myself, how do I actually go about this? I can sell insurance all day long. I can train agents how to use different healthcare plans and things of that sort, but I don't even know a real good way of shopping out my own health care. So I did that for myself. And I thought, what's a good systematic way of doing that? Well, the Healthcare Blue Book. You know, they're highly esteemed, very reputable, and they give you a fair price. So I went ahead, I shopped it out, and we showed this in a previous video. For my simple hernia surgery, I'm saving $2,557. Now, hardly big enough of an event to come down to this surgical center. I'm still going to put money in my pocket. But the point is, if I'm saving that amount of money on a surgery for something as simple as a hernia, think about hip replacement, you know, torn rotator cuff, things of that sort. It can be just not just thousands of dollars, but tens of thousands. You had actually mentioned a hernia surgery here locally running $30,000.
Oh, yeah.
Yeah. Yep. So I guess we have it pretty good up north, but nonetheless. So the steps of progression I took was Healthcare Blue Book, go to your site, and then call my own doctor in my own hospital and get the codes, get the CPT codes, find out what's going on. And time again, every time we look at this, it always seems to come back to the hospital. Our surgeon and our anesthesiologist has the prices right there. But the hospital costs are so high that it can really make it worth your while to shop out a Healthcare Blue Book, SCO, and then have your own doctor explain to you what your healthcare, what the cost of your surgery would be. So I would recommend that as a simple 1, 2, 3. Okay, another thing I wanted to mention is I have another surgery coming up. It's another very simple surgery. I shopped that one out since I'm having such a good experience here, putting $2,557 in my pocket. I checked out my other surgery, and it starts with an H. I'm not going to say what that is, but the savings I will have on that surgery is $7,500. So between the two surgeries, I'm saving $10,000 just on two simple procedures. It's just amazing. So moving forward, the agent community really has to weigh this out. Either you're going to continue to kick that can down the road and give your clients nothing more than the same old by telling them, well, you need to go to a higher out-of-pocket plan, or you can start looking at transparency. And transparency, from my perspective, starts right here at SCO. So in closing, I wanted to mention one other thing. There's a big movement that's recently started, and you're co-founder of that, and that is the Free Market Medical Association. Do you want to tell us a little bit more about that, and we can wrap up?
Yes, Jay Kempton and I, he runs a moderate-sized third-party administrator, so all of his clients are self-funded. We wanted more and more people to not just know about, but embrace the wisdom of free markets application in healthcare. And so we started the Free Market Medical Association that basically encompasses every sector of the healthcare industry that not just has embraced, but is even curious or entertaining, being more knowledgeable about how the free market works, and particularly how it works in healthcare. So there are a lot of brokers, a lot of third-party administrators, ERISA lawyers, stop-loss carriers, physicians, facilities represented, and it's a Healthcare Blue Book is a sponsor. So it's a very interesting and large group, and amongst them, the most interesting synergies happen in conversations when we have our conference, and solutions but it's, that's the market. It's sort of this organized chaos where these incredible results are obtained from people that you might not think have any sort of common interests. The Free Market Medical Association was formed really because Jay Kempton and I thought it would be a good idea to put the buyer and seller together without all of the intermediaries and their fog machines trying to make things opaque. And it's been very interesting. People from all over the country are flocking to these ideas and are seeking membership in this organization. It's got the attention of think tanks and policymakers all over the country. One of the most interesting things that's happened that has come really from the activities of the Free Market Medical Association are the self-funded plans of the states. Each of the individual states in the United States are beginning to entertain the idea of steering their beneficiaries to facilities like mine that are real honest with their pricing and waiving all out-of-pocket costs. And that's a very disruptive move, one that the state of Oklahoma undertook April 1st.
Oh,
so,
congratulations.
Yeah, and it's 189,000 lives, so it's a big group. Wow. It's very disruptive, very creepy for the bad guys in healthcare. But other states are going to copy this. Governor Rick Scott asked me to come talk to them in Florida about our experience and how it came about and how it's working. And I just got back from Montana. There's an outfit called Montanans for price transparency. And this is going to spread. The savings to Oklahoma, for instance, is estimated to be as high as $200 million in 1 year. So surrounding states are not going to sit back and watch this. It's going to give even more fuel to this free market movement. And the eyes will be on this association from which are coming the most incredible ideas about how to deliver value in healthcare and not focus on getting great discounts from the carriers, discounts off of a unknown number, but rather how much is it, and how much in total, bundle it up. I want to know all together, not how much just the steering wheel and the tires are. I want to know how much the car is, to use Jay Kempton's analogy. And increasingly, we're going to see that happening here in the United States. So the organization, the Free Market Medical Association, is very, very exciting. Our annual meeting is here in Oklahoma City next month. It will be very well attended, and I'm for one extremely excited about it.
Yeah. It's good. I think it'll be a growing movement. Definitely, we want to be a part of that ourselves. I do have to say, for those of you that are agents that have group business in the self-funded market, this is something that you definitely want to take a real serious look at. I know we've got some relationships with some big players that work in that arena. And, you hit on a little bit about the carrier discounts. Oh, I just received 48% discount.
Off of what?
Off of what? That's exactly it. So, and I have to say, at a hospital that I got a quote for my hernia surgery, can't say who it is, I've got the hospital's price, but because if I would have had my surgery in network, I would have had a 48% discount for being in network, which took me from a 6-fold multiple, roughly, of what your price is for facility to a 3-fold multiple. What a savings, right? So I'm very much looking forward to talking more and more with you about that sort of thing. And especially for the agents that's working in the self-funded arena, when you're looking at $100,000 stop loss limits per client, that's where the biggest bang for this buck is. The agents and the clients that are working in that market, they have the biggest savings by far. So those of you working in that market, you definitely want to check out SCO. So Keith, thank you very much.
Yeah,
I appreciate the interview. And in parting, any last words?
Yeah, this is an apolitical sort of message. I think people get hung up on, the free market is some right-wing idea and doesn't apply to healthcare, and it's not at all. It's about the best use of resources. It's about delivering value, real high quality at reasonable prices, and it's not a political thing. It is more about just making sure the greatest number of people can be cared for at reasonable prices so that our resources are used wisely, and then we're more empowered as individuals to be charitable with the folks who really need our help and need our neighbors' help to get their issues handled. It's a great news message, and it's all happening in spite of all of the government's attempts to take over healthcare. And it's fascinating to see well-intentioned people in the healthcare industry move this movement forward. And the most exciting thing I've seen in my life.
It's nothing but blue skies.
I think so.